Hello everyone. Good evening. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ and welcome to today's Facebook live session. I'm Dr. Vikram Raj K. Jain, consultant rheumatologist at Optima Hospital, and we are here to talk about a very important and timely topic. And before we start about the topic, I'd like to introduce our guest speaker today, Dr. Vidyasagar. Is an eminent gastroenterologist, medical gastroenterologist at Manipal Hospitals and at Optima. We are going to discuss one very interesting topic. So just to start with a small background, 50 to 60 years back, smoking was not thought to be associated with cancer. And then we realized that definitely smoking is an important cause for cancer. And now everybody is aware about this association with smoking and cancer. Another important substance which is on the rise use in nowadays, every party, every function, every conference has this. And still we are not aware that this is also an important cause of cancer. And that is alcohol. So did you know that alcohol is now officially recognized as an important cause of several cancers? And most of us are still unaware of this risk. So today, to break down to you about this risk of association of alcohol and cancer, we'll like to discuss this with our guest today, Dr. Vidyasagar sir. So just to start off, there are some new recommendations saying that risk of alcohol and cancer. What is this all about? Can you just explain to us?
Thanks for inviting me on this kind of a forum to discuss this very important topic. So yes, previously people recognized, as you rightly alluded, that the tobacco industry, people said, okay, tobacco may not be responsible for cancers. Then it became very evident, and there's no doubt about it, it causes lung cancers and predisposed to certain other cancers as well in the oral cavity and so on and so forth, larynx, pharyngeal cancers. Now, the myth about alcohol is that many people thought it was protection to the heart. Then they came about rise in liver diseases. Then they said, oh, alcohol can cause liver problems. And now increasingly, most of the Western countries where alcohol consumption is very high, they have started realizing that the cancer is on the rise. When they've tried to find out why cancer is on the rise, when they've looked at the various potential causes, alcohol has stuck out like a sore thumb. And they have now realized that there is no safe limit of alcohol. Even a small amount of alcohol, even from the first drink itself, your risk starts to accumulate to cause cancers. So that's the reason why it is very important. Recently, the US Health General issued a public advisory to the rising incidence and prevalence of cancer in the United States, based on a large population study which took place between the year 2019 to 2020, when they looked at about 100,000, that is 1 lakh cancers in the US was just attributable to alcohol, of which 20,000 people died. That is 1 in 5 people died because alcohol was the leading cause of cancer. So in summary, alcohol consumption is on the rise, cancer is on the rise, and right from the 1980s, there has been an association of alcohol and the causative that it can cause cancers, but many people are not aware of this. And this most recent data that is out there in the public domain says that alcohol is a group 1 carcinogen. That means it puts it on the same pedestal as tobacco. So just how tobacco, asbestos are leading causes of cancer, so as alcohol. So that is why it is very important. And it is the 3rd most important leading cause of preventable cancers in the world.
So that's an eye opener. I think that most of us are not aware. And even I was not aware till this advisory came that alcohol is one of the important preventable cause of cancer. But most of us, or most of people who consume alcohol will be very disappointed with this recommendation, because it is on the rise. The government promotes it, and it's available everywhere freely. So just moving on, just let us to understand. So I asked the same question to some of my friends, and they're like, how does alcohol increase the risk of cancer? What happens in the body actually with the alcohol which causes cancer?
Okay. Alcohol causes cancer in variety of patients in various forms. It has a pleiotropic kind of effect. One, alcohol is metabolized in different persons differently. So basically, alcohol is metabolized in the liver by means of an enzyme called as alcohol dehydrogenase. So there are 6 types of alcohol dehydrogenase, and it is a person's genetic makeup or the ethnicity that determines how this alcohol is metabolized. Some people rapidly metabolize this alcohol, some people do not metabolize. So that's number one. So whenever alcohol is metabolized, it forms a toxic compound called as aldehyde. So acetaldehyde. So this is the most injurious component of the metabolic pathway of the alcohol. And again, the genetic makeup determines how this aldehyde is metabolized into a non-toxic compound. Again, aldehyde dehydrogenase is the enzyme. So some people metabolize this, but in some people, this aldehyde increases in the bloodstream or increases in the body. This aldehyde is responsible for causing damage to the cells and the DNA. That is one mechanism. The second mechanism is alcohol can bring about certain hormonal changes in the body. It increases the amount of estrogen in the body. And more so in women, the higher amount of estrogen can lead to certain types of cancers, especially cancers of the breast. So this is a very important modality of how alcohol causes an increase in the breast cancers and breast lumps. Thirdly, alcohol also through its metabolic pathway releases certain byproducts called as free radicals. We know from our medical schools that these free radicals are injurious to a variety of cells in the body, including blood vessels, leading to cardiovascular and cerebrovascular diseases, leading to certain changes in the DNA of the cells, leading to mutations and cancers. And last but not the least, people also enjoy smoking when they have alcohol. So alcohol solubilizes or makes, because it's a very good solvent. So there are a lot of toxins that is present in the tobacco smoke. When they inhale, this alcohol dissolves it even more better and gets absorbed right from the buccal cavity, that is in the mouth or in the throat itself, leading to increased cancer risk in these kind of individuals.
Thank you, sir, for putting it out so clearly how alcohol, the mechanisms of alcohol can cause cancer. You talked about, we know that smoking can cause lung cancer, but is there certain types of cancer which is commonly associated with alcohol use? You talked about breast cancer in women, but what are the type of cancers which are most commonly associated with alcohol use?
Certainly, there are about 6 or 7 types of cancers that is associated with alcohol clearly without reasonable doubt. Number one, cancers of the oral cavity, Baina cancer. Second, cancers of the throat, pharyngeal cancers, Gantalina cancer. Third one is cancers of the voice box, that is laryngeal cancers, Dhvani Pettigeya cancer. So these are the aerodigestive tract. Next, as the alcohol descends down, food pipe, Annanalada cancer, cancer of the esophagus. We know that alcohol affects the liver, can cause liver cirrhosis, and cirrhosis plus alcohol together itself is a double whammy for the liver to cause liver cancers. Of course, we talked about how it brings about hormonal changes, Mahilayaralli breast cancer, Stanada cancer. And last but not the least, colorectal cancers, Dodda Karalina cancer. It is on the rise in India as well. Probably it mirrors the amount of alcohol consumption, our lifestyle, obesity, consumption of red meat, and so on and so forth. But alcohol is also a very important factor. So these are the number of cancers that can be attributable to alcohol consumption. So in summary, Baina cancer, Gantlina cancer, Dhvani Pettigeya cancer, Annanalada cancer, Stana andre breast cancer, liver andre nama yakratina cancer, matte dodda karalu colorectal cancer.
Oh, that's a nice, I mean, that's really interesting. Alcohol is causing so many types of responsible, so many cancers, and still it is freely available. And this sort of information or awareness is not available. I think it should be largely publicized in the media that alcohol is an important cause of cancer and to prevent, it's a preventable cause of cancer. Sir, few, at least we remember that with respect to liver disease and benefit, so there was supposed benefit in the heart for alcohol. They say that you can have a safe amount of alcohol. If you take little bit of amount of alcohol in men, so much in women, it is relatively safe. Is there a safe amount of alcohol when it comes to cancer risk? Like if I take a small amount of alcohol, is there the chances of cancer is less? Or if is there a proportionate, if I increase beyond a certain level, the cancer risk is more? What is the data say, sir?
This is a very important question and a very pertinent question. See, many people have a misconception, as I alluded to earlier, that, oh, alcohol is safe for the heart. Red wine is good for the heart. Yes, this red wine good for the heart comes from a study dating back to 1926 to 28. This was a study done in France and Italy when they looked at people who consumed moderate amount of red wine, a glass or two of red wine daily, despite eating a lot of cheese and other things, but they had good, cardiac outcomes. They did not suffer from cardiovascular illnesses. But when they looked at these kind of people, also had a very good lifestyle. They also had Mediterranean diet. They did a lot of physical activity, and also they found an important phenol that is present in red wine, basically the skin of red grapes, something called as resveratrol. So that protected against the vascular ಅಥವಾ ನಮ್ಮ blood vessel in intima lining. It protects that and prevents the formation of plaque. So, but subsequent studies in the 80s, 90s, and 2000s have disproved that this alcohol consumption, any amount of alcohol consumption, is not good for the heart. So that is a myth. So cardiovascular disease, certainly there is a link with alcohol, even with small amounts. Number two, subsequently, maybe a decade or a decade and a half ago, there was concern about alcohol and rising incidence of liver. WHO came up with a statement saying that 14 units of alcohol per week in a woman, 21 units of alcohol in men per week is safe for the liver. But recently, as I told you, from 2020 onwards, WHO has issued a statement that there is no safe limit for alcohol, especially when it comes to cancer. So cancer is the silent killer. Cancer is the biggest killer. So when it comes to alcohol and cancer, there is no safe limit. It starts from the first drink itself. So yes, sorry to disappoint a lot of listeners and viewers over here, but this is the true fact and a hard fact. And many individuals, including doctors and healthcare professionals, are not aware of this link. But I think with dissemination of knowledge, ಈ ತರ ಚರ್ಚೆ ವಿಚಾರಗಳು ಈ ತರ ಫೋರಂಗಳಲ್ಲಿ ಮಾತಾಡಿದಾಗ ಇದೆಲ್ಲರಿಗೂ ಇದನ್ನ ಈ ಒಂದು ವಿಷಯ ಮುಟ್ಟಿದಾಗ people will become more and more aware, and we can improve the health care of the community and the country as a whole.
Excellent, sir. I think it's a big take home for all of us, especially with this latest recommendations that no amount of alcohol is safe. So what we were previously telling, what we previously were taught to understand that, okay, a little bit of alcohol is okay. It may be useful for the heart, but now we have more and more information that alcohol, even small amount of alcohol, is associated with lot of diseases, heart disease, as well as cancer risk.
Yeah.
Yes, sir. Yes, sir.
I had a point over here. See, again, the data from US, they looked at the amount of deaths and the incidence of cancer when people took heavy amounts of alcohol, moderate amount of alcohol, less than moderate amount of alcohol, and occasional drinkers. That is just one drink occasionally, once in a blue moon, like a birthday party or something. Then they looked at the amount of cancer incident that occurred. So people who had occasional alcohol, they found alcohol attributing to 185,000 cases of cancer detection. When they looked at less than moderate, that is 10 grams of alcohol per week, they found around 2 lakh cases. When they looked at moderate drinkers, they found nearly again 1.9 lakh cases in a year. And when they looked at heavy alcohol consumption, they looked at about 1.5 lakhs per year kind of alcohol associated cancers. So this data actually tells us whether it's less than moderate amounts, heavy amounts, or even very minimal amounts, alcohol is a mediator for. That's where the data, and this data is pretty strong. It's not about 2 cases, 3 cases. It's about, we're talking about the population statistics. And therefore, this has to be taken with a grain of salt. Yes.
So even once in a while, occasional alcohol is also.
Yeah. Having said that, that's a very important question. Many people will say, how can you be so sure? We see a lot of people who drink gallons or who take a sip, nothing happens. So in medical studies on journals, we look at the risk. How do we associate it to risk? There are 2 types of risk. One is called as relative risk and one is called as absolute risk. What I'm talking about is relative risk. So relative risk means, absolute risk means If someone takes alcohol, definitely he'll get cancer. That is called as absolute risk. These are called as relative risk. So basically, it increases your risk of ಕ್ಯಾನ್ಸರ್. ಸೊ ಜನಸಾಮಾನ್ಯಗೆ ಅರ್ಥ ಮಾಡಿಸ್ಬೇಕು ಅಂದರೆ, ಸೇ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಒಬ್ಬ ನಿಧಾನವಾಗಿ ಗಾಡಿ ಚಲಿಸ್ತಾ ಇದ್ದಾನೆ at the rate of say 20 kilometers per hour, and another person who is going at 80 kilometers per hour. What is the risk of a person who is going at 80 kilometers per hour having the risk of an accident and dying or having serious injury because of the accident? It will be the person who is having 80 kilometers per hour speed rather than a 20 kilometers per hour. It does not mean that 20 kilometers will never get an accident, 80 kilometers will always get an accident. So that is the difference between relative risk and absolute risk.
Perfect, sir. That's very clear. The risk assessment has to be done. Anyway, so we talked about amount of alcohol, but the type of alcohol, whether you drink beer or wine, red wine, any other type of wine, vodka, does it matter when it comes to cancer? That will be, some people say, I drink only this, I drink only that. Does that matter when it comes to cancer risk?
No, whether it comes to cardiac risk, whether it comes to the liver risk, or whether it comes to the cancer risk, it is the alcohol, it is the moiety of alcohol which causes. So it is not the type of alcohol, it is the alcohol per se which is injurious. Okay, so people will say, oh, I take menthol cigarette, I take a cigarette without filter, with filter, that, this, everything. But we all know that tobacco smoke causes cancer. Likewise, whether you have beer, whether you have vodka, you have gin, or you have whatever, they're all attributable to cancer risk.
So we talked about the risk now we have understood with alcohol and cancer. So there's also data regarding smoking that if you smoke for so many years, your risk of cancer increases. But if you stop after few years, the risk actually improves. A lot of the adverse effects actually improve. Is it the same with cancer, with alcohol also? That if I stop drinking, say now, and so after few years, does the cancer risk go down? Is there any information or data about that?
Yes, certainly there is some data when they've looked at population-based studies. People, the risk to go down to an average level would take at least a good decade of alcohol-free period. So yes, the stopping alcohol doesn't bring down your risk immediately, but just like how a train stops, when you put the brake here, the train stops after about 100 meters. Same way, smoking as well as alcohol, once you stop, the risk doesn't become zero immediately. It gradually, with each passing month and year, the risk keeps on getting lesser and lesser.
Wonderful, sir. Now, yes. Is there any, there are some questions also which we will take up soon. So is there any particular population which is more vulnerable to this risk of alcohol and cancer, or gender difference or ethnicity difference, which makes some people more likely to get cancer with alcohol? Who should be more worried if they are alcohol takers?
Okay, good question. See, if you start young, the amount of cumulative toxicity because of alcohol is going to be longer. So if someone starts alcohol at, let's just for the sake of discussion, if someone starts drinking alcohol at the age of 60 and their lifespan is another 10 years, 15 years in front of them, so the amount of alcohol they're exposed to is 15 years. So someone starts alcohol at a younger age group, say at the age of 25. So they have 50 years of exposure. So the longer the duration of exposure to alcohol increases the risk. So one is the duration of alcohol. Second, we have talked about the volume, the amount of consumption. So whether it's lesser, moderate, higher, the risk always is getting more and more. The volume also increases. Certain ethnic populations, I don't have the data at hand, but gender, yes, certainly. Alcohol in women, there's a higher prevalence of breast lumps and breast cancers. In men, it is associated with higher prevalence and incidence of colorectal cancers, Dodda Karolina cancers. The next important would be, of course, the oropharyngeal cancers, ಬಾಯಿನ ಕ್ಯಾನ್ಸರ್, ಗಂಟ್ಲು ಕ್ಯಾನ್ಸರ್, ಮತ್ತೆ liver cancers. These are the kind of cancers that we see.
So before we move into the questions, sir, to the audience questions, one point which comes to mind is, okay, alcohol is now known to be associated with cancer. There are some groups which are more vulnerable to cancer, and there's no amount of alcohol which is safe enough. Obviously, the relative risk is different. But can we do something? Can we take some steps to reduce the risk? What would be suggestions if somebody is already taking alcohol? Uh, is there they can do something, lifestyle changes, like to reduce the risk of cancer if somebody is alcohol and not able to stop immediately?
Sure. So before I go on to take on this question, you also talked about who are the vulnerable populations. So this is what we talked about. One is the gender differences, one is the age and the amount of alcohol and the duration of alcohol exposure. The other thing is that people who also concomitantly smoke, so smokers at higher risk, to obesity. So we know in the Western population, the three most leading causes of cancers is number one is tobacco, number two is obesity, number three is alcohol. So obese people are more vulnerable to the toxic effects of alcohol, to smokers. So therefore, these are the vulnerable populations. So coming back to answering your question, how to reduce the risk? So I would like to answer this question at an individual level, at the community level, and at the country or the state kind of a level. So as an individual, yes, become more aware, inform yourself about there is a vast amount of educative material about the risks of alcohol. So make yourself more aware. That's number one. Number two, seek professional help when you feel that you are consuming alcohol, but you are unable to stop alcohol or cut down the alcohol. There's a lot of support groups, support services that is available through the help of counselors, through the help of mental health care physicians, and your own family physicians who will be able to offer that kind of a brief intervention to help to curtail your habit, reduce the amount of alcohol consumption, and also help you to be completely free from alcohol. So that's at the individual levels. And most importantly, family plays a very important role over here because many family, especially in problem drinkers, heavy drinkers, family umpteen number of times would have requested the concerned individual to stop, but they would have given hope. And many of these people, it's more of a mental health issue because they go on craving for alcohol. Support from the family is also very important because many people write these people off. Now, ಇವ್ರಿಗೆ ಎಷ್ಟು ಹೇಳಿದ್ರು ಕೇಳೋದಿಲ್ಲ ನಾವು ಕೈ ಬಿಟ್ಬಿಟ್ಟಿದ್ದೀವಿ ಅಂತಾರೆ. So I think family should also recognize that it is not the individual, it is actually the mindset of that individual, and they need that kind of professional help. So that's at the individual level. At the community level, yes, increasingly there should be education and knowledge dissemination at the school levels, at individual public gatherings about education materials, pamphlets, and everything should, and what we are doing like on the Facebook Live, how we disseminate knowledge to the community. So this is at the community level. Schools should educate the children as well as the parents in the parent-teacher meetings or in the school days and about the harmful effects of alcohol and making healthy choices in life. And at the national level, our national leaders, including industry and the various societies like health professional societies, like the Liver Society or the Gastroenterological Society or the Physicians Associations of India, should bring in strong regulations about alcohol policies in India and help the government of India and the state governments to curb excessive amount of alcohol, to minimal pricing of alcohol, the timings about the sales of alcohol, and the age limit where alcohol should be served or sold, and these kind of things. And associated with the inflation, the alcohol prices also should be jacked up, which deters the public from easy access to alcohol. So there's a lot of policies at the national and the government level, at the individual level, at the community level we have to take.
Absolutely, sir. And I'm sure, like how now we know that smoking causes cancer, and obviously the usage of tobacco has significantly, if not completely, reduced. I'm sure with this sort of suggestions which you have made at individual, community, and the national state level, we'll be able to definitely control or stop this preventable cause of cancer, which now more and more we are realizing, we're getting more and more information that how important role it plays in causing cancer. So we'll just move on to our questions. We have some questions from the audience. Jeevan is asked, I think some of them we have already answered. One question from Pallavi: how can healthcare providers effectively screen for and intervene with patients at risk for alcohol-related cancers?
Okay. So normally most of our medical school teaching is we take history of a patient who comes to consult you for a variety of health problems. We also, there's a small subsection where we actually discuss about their social habits, about their alcohol consumption, beverage consumption, tea, coffee, tobacco, etc., etc. So this is actually an eye opener for many of the physicians to offer counseling and offer the brief interventions and to educate people about making healthy life choices, healthy lifestyle habits, and curtailing the alcohol. So that's at the individual physician level, every family physician, every specialist, irrespective of their specialty that they practice, should be able to offer this kind of a counseling services and health advice to an individual patient whom they see.
So Pramila asks, are there any promising new treatments or interventions targeting alcohol-related cancers?
The most important is primary prevention. Primary prevention is educating yourself and stopping alcohol, stopping the consumption of alcohol. See, secondary prevention and tertiary prevention are when the disease has already occurred. Yes, treating that particular disease, such as cancer. Once you've treated the cancer, preventing its recurrence through surveillance and rehabilitation of that individual. So rather than addressing the secondary and the tertiary levels of prevention, we ought to focus our attention to primary prevention, that is, curbing alcohol consumption is the most important thing. Yes, cancer treatments has improved by leaps and bounds over the decades. And certainly for all the kind of cancers that we've discussed, including breast, colorectal, throat cancers, mouth cancers, early detection through of these high-risk individuals through screening camps and screening clinics, and offering them regular surveillance if they're at high-risk individuals. And early detection will lead to early treatment and better outcomes in these kind of individuals. And of course, cancer therapy has improved from a generalized care to a much more individualized, personalized care with precision medicine these days.
Yes, sir. Totally agree. Cancer treatment has improved, but we should focus on primary prevention, and that's what we're doing by this medium. Shilpa asks, how does alcohol consumption impact cancer risk in individuals with a family history of cancer? So are they more vulnerable for that?
Yes, certain types of heredofamilial, ಅಂದ್ರೆ ವಂಶ ಪಾರಂಪರ್ಯವಾಗಿ ಬರತಕ್ಕಂಥ cancers, say maybe colorectal cancers, say in the presence of men, certainly alcohol causes the DNA damage within the lining of these kind of cells in the intestine and increases the risk. Yes, breast cancers are sometimes hereditary. We see a whole lineage of the family, mother, aunt, dodamma, chikkamma, sister would have had breast cancers. So again, alcohol consumption increases the risk. Of course, these hereditary cancers will have certain cell line mutations, like for example, in breast cancer, BRCA mutations anta irtade. So these kind of mutations can be further accentuated, and alcohol will only be a multiplier over here rather than reducing the risk.
Great, sir. I think there are no more questions. We had our, there's one more question last, I think, which is already answered. Can quitting drinking reduce cancer risk? And if so, how quickly? I think you answered that. It would take some time for the
Yes.
effects to sort of go away, and probably take up to a decade also.
Yeah.
So to summarize, sir, I think we have now realized that alcohol is a strong association with cancer, and any small amount of alcohol also is associated with cancer. Any take-home messages for our viewers? I know we have a big mountain to climb. Alcohol is on the rise. Everybody, even the government promotes it. It's available everywhere. And now we are coming out saying that alcohol is strongly associated with cancer. The awareness has to improve. But what are the messages to the general public about our topic here?
So I think increasing awareness, knowledge dissemination at the individual level, and of course, making healthy choices is the way forward. And of course, offering support to your loved one, family member, friend who has an issue with drinking, and offer them and help them to seek professional advice to get rid of this alcohol. And of course, if you know someone with a high risk individual who is at risk of taking vast amounts of alcohol or whatever amounts of alcohol, educate them about the risks, and of course, signpost them to their appropriate family physician or the specialist to assess that risk. At the government level, we see alcohol bottles putting pictures of only women who are in the carrying, saying that this is harmful for the fetus. Just like how they have advertised on the cigarette packets that it can cause oral cancers, they've given pictorial evidences of bad, ugly pictures of people with cancers of the lung, people cancers of the mouth, tongue, and things like that. Probably alcohol should also start putting pictures on the bottles that it can lead to these kind of cancers that can be a deterrent to the public. So that should come at the policymaker level, at the industry level, at the government level, I feel.
Absolutely, sir. We are in Bangalore, hub capital of India. So yes, information, awareness, and I think even role modeling will definitely be very important. Now, when people realize that there is a risk, there is an increased risk, even with small amounts, and how strong the data is, I'm sure people will make better and informed choices. Thank you so much, sir. Thank you for taking time and very clearly explaining about the association of alcohol and cancer, the risk, the vulnerable groups, and how the mechanism it occurs, and what are the associated risk factors. Thank you so much. I hope you guys enjoyed. And if you have some more questions, please put it up in our chat. We will take it up with Dr. Vidyasagar and try to answer them. Thank you all. Ellargu namaskara. Thank you so much. Thank you, sir, for joining us.
Thank you.